Hello everyone, and a very warm welcome to our November newsletter in which we provide a brief update of some of the health awareness events during this coming month. My name is Sabine, I'm the Community Engagement Officer, and this month I'm joined by Rebecca Van Wollingen, our Chief Executive Officer, and also Amanda, our Community Health Nurse, will be joining us in the end to tell us a bit more about some health promotion subjects. Welcome, Beck.
Thank
you so much for joining me.
No problem.
I just thought with the recent event that we had in Timboon with regards to COVID, and not only as a CEO but as with your background, education background and your work background in infectious diseases, that you probably are the best person just to explain to the community with the recent events, is it a major event, or is this the road to COVID normal?
Great, thanks Sabine, that's a great question. So I think recent events are an indicator of the road to COVID normal. I think any kind of event that happens at the moment is a bit intimidating for people and might feel a bit scary, which is a reasonable thing to feel. But as we start navigating our pathway out of restrictions and I guess into COVID normal, we'll start to see more events like this happen. So in summary, essentially someone in the community was a COVID positive, and they went somewhere in the community, and people had contact with them, and obviously we had to test people and see if other people were positive. So I think the good news was there was very minimal spread of that COVID case, which hopefully is the case going forward because we have such good vaccination rates. Our vaccination rates are first dose are above 95%, and I think as of Monday this week the second dose was about 88%, so we're doing really well. If you have a first dose, please make sure you get your second dose, and if you haven't got a first dose, please consider if it's the right option for you, and if that's something that you might do to help yourself get back to COVID normal. So essentially, we had a case, vaccinations rates stopped it from spreading really quickly, which was great, or really spreading at all. And this response was and will always be, find out who the contacts are, isolate who needs to be isolated, and test everyone else to make sure that it's not spreading. And I think, we have some good systems in place. It was a really good test run. It went pretty quickly. Our first mass testing event, there was a little bit of delay. Thank you for the first people who arrived. They were the most patient. They might have had a 45-minute wait, but then we got faster, and then the second mass testing day we did, no one waited more than 20 minutes, and it was really effective. So it's helped us to put a lot of systems in place to support the community when this happens again. I think the road to COVID normal is that we now need to start expecting that it will become normalised. So influenza is a really good example. So no one worries about influenza pretty much anymore. People regularly get vaccinated for influenza, and they treat it as a part. Of course, if someone gets it, it's not the end of the world. But people still die of influenza, but we're just more mindful of it and we treat it like normal. So I think we're not quite at that point yet for COVID, but that's kind of the future we're hoping for, that we'll understand the impacts it has, that what people can do to control it for themselves, and then how that looks for a society going forward.
Yep. Yeah, well, that's very good to know, because you do get that kind of panic initially.
Yeah, and I think with anything, the good reminder is, I think actually COVID was a nice reminder that human beings are kind of gross. Like, we carry germs and bugs, and that's just normal. Like, we forget about that. So, wearing a mask is not a bad thing. Lots of countries do that normally anyway. Yep. Washing your hands regularly, maintaining 1.5 metre, just particularly from people you don't know.
Yeah.
They're all good things to do. They're not necessarily new things. They're new. They seem new to us, but they're good things to do for infection prevention.
And with that in mind as well, what would be your key messages as we are easing restrictions? The Victorian government is there's still key messages, like you say, hand hygiene would still probably be very important. Yeah, what would you? Yeah,
I think my most important message is don't panic, and don't treat other people poorly or differently because you're worried about that. Ultimately, you're the best defence for yourself. So if you're not certain, take a minute and a breath and look at the situation and assess it. Maintain 1.5 metre, put a mask on, wash your hands, or if you're really worried, remove yourself from the situation.
Yeah.
So I think people's attitudes have really what's shown through in COVID, and I think we've seen the best and the worst of people, and I think we've seen more of the best of people than the worst, which I think is really lovely, and I think our community certainly have reflected that. So I'm very proud of our community and our staff for that. But yeah, I think our attitude about how we take this on will affect the future of it, and so my biggest piece to people would be, be kind, think it through. If you're worried, take your time. It's not a rush.
Yep.
And then do the things that you can do to protect yourself.
Yeah, and it's like you say, and I think that is very important as well, that you have got that control. Like, it is actually something you can
do for yourself. That's right. Yep. And I think the thing is, as it becomes normalised, people are going to get COVID.
Yeah.
Like, it's not going to be that, like this is, no one's a leper anymore. People will get COVID. It's not something that we have controlled. It's something that will now become, most likely endemic to our community over time. And so at some point, people are going to get it.
Yeah.
And people get influenza and people get other illnesses, and that's just how the world works. And so, our response to that and our understanding of that will impact how we feel about it and what the outcomes are.
Yep. No, definitely. And as you said, our district has been great.
Yeah,
we're
fantastic.
above the rate with vaccinations as well. If people are still considering vaccinations, what are the vaccines that we have available at the Timon Clinic? And also, can you tell a bit more about the booster vaccination that is now in the news as well?
Yeah. So vaccinations, so that is also something you can do to protect yourself, which we didn't really mention before, but you can get vaccinated. Vaccination is a personal choice, and, I'm pleased to see that large portions of our population have made that choice. If that's a choice you're struggling with or you're not sure about, there's lots of resources on the department's website or ATAGI's website to give you some information and advice around that decision making. And or you can go see your GP who can give you further information about whether it's the right choice for you. So there are 3 kind of vaccines available in Australia at the moment. There's AstraZeneca, which I think is currently only recommended for people over 65. I haven't seen the advice in the last week, but it's something like that. Pfizer, which is I think available for every age group at the moment, but it's the recommended one for people under 65. And then there's Moderna, which has just recently been released in Australia in the last month. I don't have a lot of information on that one, but we have a large supply of Pfizer at the moment and AstraZeneca. So we have access to those too, and there's the ones we've been using available at our GP clinic.
Yep. So people can just call.
Yep, people can call ahead. We do have a slight waiting list, so if you call today, you won't get an appointment today. We also, there's some, the vaccines have to be undone in a group and things like that. So we do vaccines on certain days, so you need to call ahead and book, and they'll book you into the next available time slot, and then they'll book you in the appropriate period after. So you need 2 doses for it to be the most effective.
Yep.
And Pfizer is a 3-week gap between the first dose and the second dose, and AstraZeneca is a longer gap. But they do change a little bit. Sometimes the government comes out with a different direction around when they change. So the GP clinic are completely across that and will book you in as appropriate.
Yeah.
So the 3rd dose or the booster,
yeah.
It's fundamentally, so you've had a course of vaccine and then this is just an additional dose to support that course of vaccine. It's recently been approved by ATAGI, which I keep saying that word, but that's the Australian Therapeutic Goods Association or industry. Essentially, the 3rd dose is going to be available to priority 1, like healthcare workers, particularly in aged care, I think from the 8th of November. I believe it will become available to the public, but I'm not privy to when that will happen, but I'm assuming that will happen shortly. If you've had your 2 doses, I believe you have to have a 6-month wait between your 2 doses and the 3rd dose anyway, so a lot of our community members aren't quite eligible yet. I wouldn't panic too much though. When that's available, we'll put the information out, we'll make sure doses are available to people, and we'll support people to get their 3rd dose. But I think if you've had a 1st and 2nd dose, you would make the assumption that a 3rd dose is just a part of the course for this treatment or for this preventive measure. So you would just treat it as part of your 1st and 2nd dose.
Yep.
And then as we learn more about how COVID normal is going to happen and what it's going to look like, we'll get more information about how often you have to get vaccinated for COVID.
Yeah, and that'll be, like you say, a bit like the flu vaccination, then you'll get the boosters and all that happening.
Yeah, yep, and it might be that you get revaccinated every year, or it might be that you get a longer period of time. Time will tell us with that, and we'll be directed by the government and ATAGI and their resources.
Yep, and so even though people might have both vaccinations, it's still very important to keep an eye on
Yeah.
the symptoms and
Absolutely.
get tested. Yep.
Yeah, so vaccination doesn't stop you from getting COVID necessarily. It can minimise your chances of getting it, and it'll absolutely minimise the consequences. So, you know, if you do get COVID and you're vaccinated, you're much, much less likely to get acutely unwell. You're much less likely to get hospitalised, and you're very, well, not unlikely, but much less likely to be put in the ICU. So part of that is about system impacts, right? So we want people to be vaccinated so hospitals don't get overwhelmed. Hospitals in the city are still getting large numbers of cases, but less people are having to go to the intensive care unit, which is really good. So those beds are available for real things, or other things, like car accidents and stuff like that. So, you know, vaccination is important to help the whole system and to help yourself from getting really unwell, but you could still potentially get COVID. And I think the value in knowing that is that if you have signs and symptoms, get tested, because you could be sick and not feel too bad, but you could give it to someone who's not vaccinated and then they could get really unwell.
Yeah.
So it is about everyone together and how we impact each other in that way.
Yep, and so we've got testing available for people, which is on our website as well.
Yep,
the days
absolutely.
And there's a new system involved with people can register and get a QR code to make it go quicker.
Yep, so currently as a general rule we have testing on Monday, Tuesday, Thursday and Friday. We offer it in the morning and the afternoons on Monday, Tuesday and Thursday, and just in the afternoons and Friday. And there's a QR code, I think it's on the website.
Yep.
You essentially just flash that, fill in your details. It's a government testing app,
Yep.
so it just goes all in there, and then we get then we just QR code you when you get here, and then we send off the results and we can check those QR codes ourselves.
Yeah, so it goes a lot quicker.
Yeah, much quicker.
All right, great. That's great. Thank you, Beck.
No problems.
I think it's important to to calm the community and let them know that it is coming. And it is out there, and that is something we have to live with.
Yeah, and I think it's important that we don't know everything. We don't know all the answers all the time. We might say something one week and then something slightly changes because we have more information. That's not necessarily bad. That just means that we're moving and growing with the situation as it is, and it, indicates that we're flexible and we're understanding to take in new information. So I think don't panic if things change a little bit, and don't feel worried if you don't know everything about all the things at once. It's okay. You know that you can do things to protect yourself. Get vaccinated, wear your mask, stay 1.5 meters away, have good hand hygiene. Do your QR code when you go into buildings so you can be traced if you need to. They're the things that you can do for yourself, and then I think the rest will slowly start to take care of itself.
Yep.
That's my plan. It's my hope, yes.
No, that sounds good. And if people have any concerns or queries, they can talk to their GP or...
Yep. Or the department website. The department website is excellent.
There's information out there.
And there's helplines and all kinds of things on there. And if you've got, if you're struggling with mental health or finances or anything like that, the website's got lots of different... You have to trawl through a little bit sometimes, and might have to be a bit careful about what you put in your search bar, but there's quite a lot of information on there.
Yeah, and what they say, information is power. And
absolutely.
Knowledge is power.
Knowledge is power.
Yep. So, well, thank you very much, Beck.
My pleasure.
For explaining that and reassuring the community. I now hand over to Amanda, who will highlight some of our health promotion subjects during November.
Thanks, Sabine. National Cervical Cancer Awareness Week 2021 is held every year early November. The theme of the week will build on last year's message and encourage women aged 25 to 74 that it is time to catch up. With the uncertainty and the impact of the pandemic, more and more women and those with a cervix have fallen behind in keeping up to date with their cervical screening this year. We hope to raise awareness during that week that will build on the World Health Organisation's vision of a world where cervical cancer is actually eliminated as a public health problem by 2030. For more information or to book an appointment with myself, you can call 555 86 000. Movember. Men's health is also in crisis. Men are dying on average 5 years earlier than women, and for largely preventable reasons. A growing number of men, around 10.8 million globally, are facing life with prostate cancer diagnosis. Globally, testicular cancer is the most common cancer among young men, and across the world, one man dies by suicide every minute of every day, with males accounting for 75% of all suicides. That's alarming. Movember is uniquely placed to address this crisis on a global scale. We fund groundbreaking projects all over the world, engaging men where they are to understand what works best and accelerate change. From 30 moustaches to 5 million, from humble beginnings, the Movember movement has grown into a truly global challenge around the world to grow moustaches. 5 million since 2003. Their enthusiasm fuels the Movember movement, their support changes lives, and for them, Movember is committed to keeping things fun, fresh and inspiring. So sign up or donate today by going to their website. TDHS partners with WIDIA, and twice a year we offer first aid classes. So this year it's Saturday the 13th of November at the Timboon Golf Club in a COVID safe venue. To register, please contact WIDIA. Details should be on the bottom of your screen. Another health promotion activity that's happening this year for our staff at TDHS is 16 Days of Activism. On White Ribbon Day, the 25th of November, for 16 days throughout the region, the Corangamite Shire and many other organisations, including TDHS, are supporting this gender-based violence against women campaign that lasts for 16 days. For more information, go to their website for ideas on how to engage with this important cause. The campaign aims to raise awareness about gender-based violence against women as human rights issues at all levels. It aims to strengthen local work around gender-based violence against women. It also aims to establish a clear link between local and international work, to provide a forum to develop and share new and effective strategies, and to demonstrate the solidarity of women around the world, to create tools which pressure governments to implement commitments to eliminate gender-based violence against women. So they're just a few of the aims of the program. That's about it, Sabine.
Thank you, Amanda, for highlighting these important health promotion subjects. And thank you to our lovely community for tuning in again to our monthly vlog. And please continue to check our social media story, which shows lots of information and also how resilient our community is. And as usual, please continue to be mindful to yourself and to each other. Together we can get through this and support each other on the road to COVID normal. Please stay safe, stay kind and continue to work together for a healthy community. Thank you.